Watch your mouth.
All right, we're here once again, our resident expert, and he certainly has been giving us a lot of great information right here on Bayou Time, Dr. Ryan Walker, and he brings us a lot of different topics and a lot of different things. And today, we're going to talk about cavities, fillings, and x-rays. Before we get into the questioning, Doc, good to see you.
Good to see you, Martin. Thanks for having me.
How was your Thanksgiving?
It was fantastic.
Good. I know y'all have a lot of people that get together on your side.
Yep, it was good. Everybody's healthy and happy. All good.
All right, here we go. So when we're talking about these type of cavities, fillings, and x-rays, I guess we start off with the basic, which would be getting an x-ray. And how much does the x-ray show you, and what kind of a great tool is that for you?
So, if you go to the dentist, it's recommended once a year that we take x-rays. A certain type of x-ray called a bite wing x-ray. And you might be wondering, why once a year? What do we do that for? Is it necessary? Well, the x-rays help us see things that we can't see clinically. So you're going to see in just a minute, we're going to put up an x-ray, and, very subtly between the teeth, this is what it allows us to detect. You might look at it and go, well, I don't see much there. It's very subtle. But that's what a cavity looks like between the teeth when it just starts to form. And early detection is everything. X-rays help us to see it when it's small before it gets too big. And by the time that gets big enough to see it in the mouth, it's really big. Already lost a lot of tooth structure. So really the X-rays are just early detection and allowing us to see between the teeth, because you can't.
So bring it up again, Jay, real quick. That little dark area where the arrow's pointing.
It's a little triangle. Yep, that little dark area goes through the enamel, and the little dark area on the back side's in the dentin. And you'll see what that looks like clinically when we go ahead and open that up.
Okay, that's a good point. So, but when you get down to it, what really causes the cavities? I mean, is it just a bunch of factors, or is it more one?
So this is, we talked about before in previous sections, it's acid. It's acid in the mouth, either direct acid, meaning something you're drinking is acidic, whether anything that has an acidity of below 5.5 pH, that's going to start to demineralize the tooth structure. And on that x-ray, you see right where the teeth touch, where the teeth come up and touch, that's where things hang up. Mm-hmm. And if you don't get it clean, they're going to start to demineralize the tooth. So direct would be, acidic stuff you drink. And indirect would be feeding the bacteria in your mouth, carbohydrates, and then they're going to ingest that and produce acid.
Since that show, I drink about 80% water. I'm not totally off the bad stuff.
Yeah, you can't, in reality, not everybody, you can't expect everyone to just drink water.
But you did give me on 80% water.
Good. Hey,
so that's pretty good.
Whatever I can do to help.
All right. Fillings. God, as I was growing up and everybody was getting mercury fillings and all these different fillings, I don't know if there were many options back then, but now there's many options.
Now they have different, we're going to keep it simple on today's show and just say fillings. You got silver fillings, you got tooth-colored fillings. Now in the tooth-colored fillings, there are different options of materials, but that's basically it. And, I'm not going to sit here and tell you that mercury fillings are poisoning people or anything like that. I guarantee you there's a lot of people walking around with silver fillings that are 40, 50 years old, and they're still in there functioning. So I'm not going to demonize the silver fillings, but nowadays what do? We do tooth-colored fillings. We do.
Yeah.
Yeah.
And so how hard is that to do? And do you assess that every time somebody comes in? Do you look at them and say, well, this filling would work better? Is it sort of like each individual kind of thing?
No. I mean, fillings nowadays are going to be pretty much a resin composite filling, tooth-colored. And certain situations we use different materials for people that have high decay risk and stuff like that, people that we think won't probably change their habits, or teenagers that not going to change their habits. Certain fillings are just more resistant to decay, just put it that way. But for standard fillings, it's just resin composite fillings, tooth-colored fillings.
I want to look at some pictures, and I want you to go through it with us because pictures can tell you the big story. Right. So let's start off with our first picture if we can. Jay and Doc, what are we looking at?
Yeah, so this is why it's important to take x-rays, because the x-ray you just saw, this is the teeth of the x-ray you just saw, right? These are the same teeth. You don't really see anything here. It looks all right. You got some old silver fillings in there, but you don't really see anything. And you'll see in just a moment, we're going to go ahead and get down to the decay and take the silver fillings out. And you'll see why it's important to catch things early. All right, so the little red arrow, that indicates the same arrow that we saw in the x-rays. That's what decay looks like. It really doesn't look like much until you open it up. Without the x-ray, we would have never known that that was there. So that's the importance of taking the x-rays, right? So we get the old fillings out, we remove decay. And then the final product you'll see in the next picture, and there's your tooth-colored fillings. That's what it looks like.
Yeah, look natural.
Try
That's
to.
what they're supposed to.
We try. I mean, we try. We make an attempt, right?
Yeah, you
so
do the best you
it's a
can.
little more aesthetically pleasing than the silver fillings.
Let me ask you, let's go back to the first picture. Do you have a question for the doc on that? Because I used to solder all my, my wires together and everything. Is that like a similar kind of way you put that in?
No, that's you don't heat up the filling material and drop them in there with a soldering iron. No,
just
you do
had to
not.
ask.
You do not do that. Nope.
All
That's packed in there. You place them in there and pack them in
It's
there.
a whole different
yeah,
process.
whole different process.
So my old Radio Shack solderer is
No,
not going to
don't do that. Don't heat up a tooth. No.
Oh, no, I wouldn't do it. Anyway, all right, so let's show those real quick again, Jay. Just go through those slides. There's the first picture, and let's go to the second one where you can see the decay. And then let's show the final product. Hey, you did a good job on that, Doc.
Thanks,
You
Mark.
could do some good body work on automobiles.
That's exactly right.
And
Just-
everything.
Just miniature body work. That's
All right.
it.
Well, as usual, we appreciate you coming by and sharing your thoughts with us. And you do a great job. Once again, Dr. Ron Walker, he's our expert here on HTV when it comes to dental. We appreciate his efforts on our channel. And we'll take a short break. We'll be back with a lot more. And he'll be back next segment with a whole new topic. So don't miss it.
Watch your mouth.